I'm James O'Brien, and this is the knee separation exercise from a bridged up position. So for this exercise, you'll want a loop resistance band. These are pretty affordable online, just a few bucks. Or you could go to your local physical therapist and ask to buy a few feet of traditional TheraBand. I think usually the blue works the best. And just tie it in a small knot like this, and that can work just the same. So to begin, you'll lie on your back with your feet together on a surface where your feet won't slip. You'll place the resistance band just above your knees. Your toes should point forward. You never want to have your toes pointed out to the side like that. That's a good recipe for knee pain. So make sure that the toes point forward. You'll get into a good standard bridge position. So that is lifting up while clenching your buttocks firmly together, pushing the knees out away from the body, pushing the feet down and forward. Once you're up in this good standard bridge position without hyperextending your lower back, you will separate into the resistance band and then return to the start position. So do this 10 to 20 times in a row. As you do this, try to think about keeping your big toes grounded on the floor. If they come up a little bit, like they roll off, that's okay. But if you can keep your big toes grounded on the floor, it'll actually help strengthen up your feet. So that's a good thing. So separate 10 times or 20 times, 10 to 20 times, like so. The second position would be with your feet about hip width apart. So from here, you'll bring your knees together and then separate. Again, avoiding that hyperextended back. Again, trying to keep the big toe grounded on the floor. Lastly, you'll take your feet about hip, a little bit wider than hip width apart, and do the exact same thing. All the rules remain the same, avoiding lumbar hyperextension, trying to keep the big toe down, making sure that the feet point forward. With that last position, however, I have had a few patients in the past who have complained of a little bit of knee pain with that exercise. And I think the reason for that is as they come in like this, as the knee comes inward and the tibia and the foot relatively rotate outward, that can generate some knee pain. So if you're getting any knee pain with this, don't do that position. In fact, I would just stick with the position where your feet are straight together, where your feet are together. If you feel this exercise is too easy, put 2 resistance bands on. Always listen to the body. If you're getting any low back pain with this, really be mindful. Are you hyperextending your back? If you're still doing it with good technique and it's still hurting your back, don't do it. All right? It's very common when people try and do bridge-like exercises that they're just not ready for it yet, or that they're hyperextending their low back to generate some pain. So that's never a good thing. So that is the knee separation exercise from bridged up position.